I want to introduce you to two people who are going to have all the answers, I'm sure. These gals are, they work out at St. Joseph Hospital. And when we got ready to set this up, Kathy and I talked, and she said, let me nose around. So she found Regina, and then she and I made this connection for this meeting. And we certainly do appreciate them. This is the first one. This is the first group, am I right, that has asked her to do this. Now, what we're going to try to do is we're going to try to get this thing started for you. I know there are a lot of questions that you've had in the past, a lot of questions you have tonight. But one of the things that's going to impress you is that this is going to take a little bit of time. It's not going to be something we're going to do tonight and it's over and you go home, you know, and you've signed the papers and everything's where you want it to be. She's going to explain all of that to you, and where you have to go from this point on. Sign up is not going to come until November, thereabout, I think. And then from that point on, everything will meld together. Now, a couple of things that you need to remember. We're not going to leave you behind on this. We got this started here, and if we need to do more things down the road, we will. We'll still get those answers for you. They're simply going to make a presentation, let you know what there is to know about it that they can present, and then we'll open the floor for your questions. I know there are a lot of those. To go on then, let me see, I'm a navigator. I've been calling her a facilitator, or these two ladies, facilitators. But they're navigators. In other words, they're going to navigate you through this system and help you to get to where you need to be or want to be. I'll introduce the first, which is Regina McQuinn, who is the first I talked to, and then she brought along with her Carrie McBarnett. So I'll just turn it over to you.
Okay, thank you. Thank you for your service. My name is Regina McQuinn, and we work for Medicis, a First Source company, and we are a contracted company at St. Joseph Hospital. And we assist self-pay patients to get insurance coverage. So we are here for a courtesy tonight for you. Okay, so with the marketplace, can you guys hear me okay? Okay. The open enrollment for 2015 begins November 15th. And it goes through January. Sorry, now I'm getting too close. The marketplace is for people who do not have health insurance, because we are all required to have health insurance. But they do give tax credits, which everyone's hearing stuff about, especially today. Tax credits which helps offset the cost of the monthly insurance. But it's different for everybody, depending on your marital status, if you have children in your household, how much your income is, where you live, if you use tobacco, everything. Because if you use tobacco, your rates will go up 1.5%. So that is something to keep in mind. And you have to be tobacco-free for 6 months for the rate to go back to an average person. Or I should say a non-tobacco user, not average. Now, there's all different kinds. There's 5 health plans currently: Anthem, MDWise, Marquee. The most important thing for you to know is you need to talk to your doctors. You need to find out what marketplace plan they are accepting. Not all doctors are accepting marketplace. So before you pick a plan, you need to make sure you know what your doctors are accepting. And also, certain hospitals here in the community are only accepting certain plans. St. Joe only accepts MDWise. Howard accepts Anthem plans. Now, just because you may have had Anthem in the past, it's not the same Anthem. It's not Anthem Blue Cross Blue Shield. It may say that, but it's a very different coverage. So you can't just assume, oh, I had Anthem, my doctor took that, it's fine. No, you have to specify it's a marketplace plan. That way you don't get coverage, and then you go to your doctor and like, we don't accept this. So Prices vary depending on where you live. So if you live in a different state, it would be a different pricing. But the information, we're going to hand out a handout to you. And I apologize, we can't do a PowerPoint because our company prohibits us to bring laptops because of HIPAA. So we have to kick it old school for you, give you a paper handout. But on the handout, it'll take you through step by step. What you can do now is go to the marketplace and set up an account. But you cannot go through it because if you go through it now, because you currently have insurance, it will not give you any tax credits, and it will quote you at a private rate, which could be $800 to $1,000 a month. So I encourage all of you just to wait. I know you're anxious to see, but you can also go through and see sample plans for your area. Why don't I just tell you now? I did some sample plans. So I just did a 50-year-old male, household of one, who made approximately $1,200 a month. Now, they go by your gross, so it's not what you bring home, it's what you actually make. So it is your gross. So a gross of $1,200 a month for a 50-year-old individual, household of one. You receive a tax credit of $424 a month. Now, are any of you familiar? There's a bronze, silver, and gold. Bronze is the lowest, which means you pay the lowest amount of premium, but you have very high deductibles. For example, for this 50-year-old who makes $1,200 a month on a bronze level plan for an Anthem, their plan is going to be $0 a month, okay? So they don't pay anything a month. But their deductible is going to be $500 a year. So and then depending on what your plan is, so like a primary doctor visit is $50 and 40% after your deductible. So you have to basically spend $5,000 before it kicks in on a bronze plan. Now, I also did a 50-year-old with a monthly income of $2,500, which would be $30,000 annually. Their premium for the very first, the lowest one, would be $106 a month, a deductible of $5,000. These are just some examples, but that tax credit was $239 a month. So see, I know we kind of jacked up the income there a lot, significantly, but it did take down the tax credit significantly as well. Then next, I increased it by $500 a month, making the gross income $3,000. With the annual income of $36,000 a year, you only get a tax credit of $163. Yeah, she has it right there. So, as you can see, just a little bit of increase, because I know they had talked about giving you a stipend. That will count as income, so that will change what your tax credit is. So, and I apologize that we can't walk you through it, but if you go to healthcare.gov, you'll see it. You can type in that search, you can type in any silly question you want, and it'll come up with some searches for you that you can click on. And it is very easy to navigate through. But if you have trouble, we've also included on the back page some places that you can call to get help to assist you. And we also included the federal marketplace number, and you can call and they will walk you through it as well, okay? Are you a navigator as well?
No, but
You've done it, okay. Okay, no problem. Okay, so things that we need to think about. How you do your taxes. Okay, so if you live in Florida part-time of the year and you live here sometimes, wherever you file your taxes and claim that you're a resident, that's the state that you need to look at, okay? And then it's also however you claim your taxes. So if you have a grandchild that lives with you but you don't claim them, you can't count them on this. It goes by with whatever you claim, because the IRS is connected to the federal marketplace. So you can put that you only make $1,200, but when it comes back that you make $2,500, you're going to be paying some money next year. So just FYI there. Now, another thing to keep in mind, if you have any type of health coverage that they consider a qualified plan, makes you ineligible for tax credits. So there again, that means that you have to pay a private rate, which is very high, with no tax credits. So if you are eligible to have insurance on your spouses, they're going to deem you not qualified. You need to go on your spouses. If you are eligible for VA, and if you don't know if you're eligible for VA benefits, I encourage you to contact the VA. You can do that online, or there's also a number that you can call. I know you had to do like 24 months of service, and it may qualify you for VA benefits, but they consider that to be a qualified health plan. If you have Medicare, you don't qualify because they consider that to be a qualified health plan. Let's see. And they talk about exemptions and things. If you make less than $972 a month, you are exempt from from having insurance. So I don't know if anybody's that lucky. Right. How are you going to live, right? You are more than welcome to buy insurance outside of the marketplace, but there again, you won't get the tax credits that everybody's talking about. And I know some of you might have heard on a ruling today, but that has not officially come through our wires about how they plan to address that. Now, if you guys go home tonight or in the next few weeks, the numbers you'll see is for 2014. It's not for next year. They have not set the rates for 2015, so that will change. Some of you might pay less and some of you might pay more, is what I read on my newsletter today from the federal CMS.gov is where we get information from. All the navigators, they send that to us to update us on all the latest news information. So, I think that's about all I have. Carrie, do you have anything else to add? Do you think I covered most of it? So I'm ready for questions, I think. Okay, let's go with you.
Okay, if your spouse is offered, she's like my wife, where she works, they have insurance, but she's not on it, because she's on my insurance right now. Now, will she have to be on that, or can we go to this?
She has to be on it, unless
She has to go through this?
she has.
She's offered, she's not on it right now.
Right, she has to go to her job sponsored insurance, unless it is 9.5% of more of the income. You know, sometimes it's astronomical, the insurance.
Yeah, and then if she's on it, then I have to go on it.
Correct.
So I'm not on it.
Unless it's more than the 9.5%. Because they say that is not affordable.
Is that 9.5 of their income?
Of the total family income. So not just your wife's income. If she just works at Taco Bell making $7.25, you can't just say, oh, that's more than 9.5% of her income. They go by the whole family, unfortunately. So, yes, sir.
Do the pensions go towards the monthly income?
Yes. Now, I know they figure it's whatever's taxable. So, for you guys, you need to get your W-2s from last, or your taxes that you did.
Adjustable gross.
Adjustable gross, thank you, yes. And that's what they would look at right there. Did that help you? Yes, sir.
What if you have children living in a home still that are under the age of 26,
Oh, they could go on your plan.
they can?
Mm-hmm. Now, they ask you questions because depending on the child, if the child, I'm not sure what the family income is, and I'm not sure how many you have, but in the state of Indiana, we have the Healthy Indiana Plan. It's a branch off of Medicaid, and if your family income fits the category, then they would put that child who's over 19, maybe in a Healthy Indiana plan. But it just would depend on your income. But if not, they can go on your other policy that you pick for them. And I know that this year I assisted somebody and their son was actually in college and he went out of state. So they do have multiple state policies too. And then he had to go on his own policy. But yeah, you can do all that.
Let me emphasize something on the adjusted gross too. One of the things that some of you may or may not know about is the fact that there's a up to $3,000 deductible for the premiums that you're paying into for your insurance. If you are paying in a participator way towards your insurance as a public safety officer, PSAO, you can take that off of line 16. Now, the important thing about line 16 is that it is above the adjusted growth. So it comes right off the top of your income. So that if you're making $10,000 and you're paying $2,000 for your insurance, then your adjusted growth is going to drop at least that much. Okay? So remember, always, if you file or if you have someone file for you, up to $3,000 is going to be deductible for you. So don't miss that. Don't miss that. And it's more important now from what you said.
Yes, and if you call the federal marketplace over the phone, make sure you just give them that number. Next question. Really? Okay. I know, I'm so sorry.
You're very, very good. Explain what you're doing.
Oh, yes, sir.
Have you got to work up on someone 61 years old, single or 30,000 a year?
I'm sorry, I only did 50. I wasn't quite sure of the age.
Sorry, I should have told you that, Regina. That's my fault. Because everybody here, generally speaking, will be at least 52.
Oh, I'm so sorry. I didn't know that. I thought since it's a hard job, you would get to retire early. Right. My bad.
Hey, I had a question. From what I've researched on, your age really doesn't matter though, the cost, right? Has no bearing on it?
Yes, it does.
Well, see, everything we put in sample, like through salaries, I ranged it from 40 up to 65, and I never saw a difference in pay.
You didn't?
Most of it was.
Most of it was exactly the same.
Okay. But you were doing the sample plans, right?
Yeah.
Okay.
That would be the way to find out a good idea of what you're going to get.
But it's a rough estimate, right?
It's a rough estimate, and I will just tell you that I have seen it when I have worked with people last year when I was signing them up. Age does matter. I would say from 45 on. I'm sorry, guys. I don't know what the equation is. I don't know what it is, but I know that if you're over 45 and a tobacco user, you might as well just hand over your paycheck. But if you want, sir, I can do one for 61 and then call you tomorrow. Would you like for me to do that for you?
Sure.
Okay. Yeah. But, so if they're saying age doesn't matter, I did the 36,000. And the first plan for 50 years old, $3,000 a month, which is $36,000 a year, a tax credit of $163 a month. But the number I'm giving you is already deducted the tax credit. So the bronze level is $182 a month with the deductible of $5,000. And to go to your primary doctor, it'd be $50 and 40% coinsurance after your deductible. So basically you have to spend the $5,000. But then we can move up to silver. Okay, and then for a silver plan, for a monthly deductible, it's $275 a month. But your deductible is $3,500. And the cost to go to your primary doctor is $55. And it depends what plan you pick. That's MD-wise, because MD-wise is usually like you start paying, you get to use your insurance from the get-go.
Did you do any gold plans? Is
I-
that the most common gold?
The gold, okay. I did do gold.
When you were sampling those plans, did you look at all of the plans, all 5 different plans, the companies, and they were all comparable?
We went through, no, different companies had different prices.
Okay.
But if the only variable that changed was the age, the prices were within dollars.
For all of the same exact
The
plans?
same plans. Anthem, MD-wise, all the way down the line.
The only thing that made a significant difference
Was
was
the money.
the money you made.
When you do the sample website, that's all the changes on when we did the money.
Gene, let me introduce you. These guys are on the wage committee, and they did a lot of research before they signed the bottom line. And so what they're quoting to you are numbers that they were trying to make sure they weren't making a mistake in going the route they did.
Right. I just know for my own experience that we would do samples, and then when it came time, it was a difference.
Because you said it was like 45 on up in age.
Yes.
Well, that's the reason, because our sample base was all 45 and up.
Okay.
Because nobody's retiring.
Right.
50 is probably the youngest anybody's going to be signed up to this plan.
Okay.
So that would make sense if that was the case.
And they also have, this is just a side note for you that might have grown children, they have catastrophic plans. For anybody who's 26 to 30 can have a catastrophic plan. It's very low cost a month. I'm talking like $10, but it doesn't really cover much, but at least you got the coverage. So it's just something to think about if you have grown children that you need to have insured. Okay, and now for the gold, this is MD-wise, and they tend to be the most expensive, but it seems to be most like regular insurance to me. The monthly premium is $335 a month. Deductible is $1,500 a year. Max out of pocket $6,350. Primary doctor is $20. A specialty doctor is $50. Generic prescription is $15. An ER visit copay is $350. That is the monthly income of $3,000, $36,000 a year. Household of 1. So now if you have 2 people on that household, it'll be less.
Yeah, but my wife currently has disability, Social Security.
Mm-hmm.
That takes her out of the equation then, right?
Claim that on your taxes.
How do you claim her on your taxes? She's a dependent on yours on taxes. Okay, so no, you don't have to insure her because I'm assuming she has Medicaid or she has Medicare. Okay, Medicare. So she's covered. So we just have to worry about getting you covered. But they're going to count you as a household of 2. So. Yes, sir.
Of the different carriers, have you noticed like a difference in the carriers themselves, or is as far as being recognized by wherever?
Well, now Marquee, I've never heard of Marquee, and I don't, right, and I've never heard of Marquee, and when I called places, and I'm sorry, unfortunately, because I work for St. Joseph Hospital, I usually called most of their doctors, and they're accepting MD-wise only, and nothing else. And then, so that's why it's important for you to call your doctor to see which one they're taking. But Anthem has been popular as well. And then MD-wise are the 2 that I know of. But there are other choices on there, but I've never heard of them. So if you feel like you might want to go with one of those, it's fine, but call your doctor and see if they accept it.
Is there an impact from the city has their employees have access to a clinic?
Okay.
And can you relate that to what's going on there?
I'm not sure about the clinics, but you would need to call the clinic that you like to go to. I mean, I'm sure it's the contracted one, whatever that might be, and ask which, and you have to specify marketplace plan.
But what I'm saying to you, though, is the city allows them to go there for their physicals.
Yeah.
They get free generics from that clinic. So there's really not a cost. Am I right about that, guys?
It's not a clinic like a private clinic. It's a city-owned clinic that they hire doctors to run out of.
Right.
Oh, okay.
All I'm saying,
So
all the
basically,
guys.
that is totally separate.
Yeah.
I would think that's separate. It's like your annual physical, you might go there.
So dollars or anything else, nothing impacts that at all.
I'm not sure about that. And that would have to be part of probably your negotiation with the city there.
The two most common plans in Howard County are Anthem and MDYs. And the only reason that is because most people are affiliated with one of the hospitals. They go to a doctor that prefers Howard, or they go to a doctor that services St. Joe. So those are the two majority of the plans that we see the most of, just because of the two hospitals that are in town. So if you have a doctor that is affiliated with one of those, you would want to make sure that they accept your insurance, because if not, your insurance won't cover that, and you will be 100% responsible for that day of service wherever you go. Now, if it's an emergency service, you can go anywhere, and your insurance should cover it, of course, depending on the insurance plan that you're in.
But it has to be a true
Same
emergency.
thing on like vacation.
Same thing on vacation. Yes, as long as it's an emergency, you don't have a cold, cough, and flu, and you're going to the emergency room, they'll take care of you, yes, and your insurance shouldn't give you a hard time.
What if you spend half your time in Florida and half your time here?
Depends on where you file your taxes.
So, I mean, like if you file your taxes in Indiana and you're in Florida, and you go to a hospital that doesn't accept your insurance that you've chosen in Kokomo,
If it's an emergency, your insurance should still cover that.
what if it's just, you know,
That's something you'll have to work out with them at the clinic or at the hospital or wherever you're at.
Say I'm on vacation.
Yeah.
If I'm going to a doctor or a hospital, it's an emergency. I'm on vacation.
Or you might want to check out the multi-state plan.
Yeah.
And they do offer a multi-state plan.
Another thing that's peculiar to their situation is the city is going to continue to take care of their dental and eyeglasses too.
Oh, well, that's great, because eyeglasses are not covered in most dental. Most dental is a separate plan that you have to pay. It's very reasonable, but it is a separate plan that you have to pay for. So if they're going to continue to take care of that, that's good. And like I was telling Bill, I know that they're going to compensate you some way to offset the cost here, and I wish there was a way that they could do it without it counting as part of your income, but unfortunately, it will count as part of your income. So, any other questions?
Guys, just remember, whatever your pension check is, you also have to count this money that we're receiving as income also. So whatever your pension is on top of what the city is paying is also going to be gauged.
Now, are you right clear about the pension check, or is there going to be a whole separate check? Separate check. Every month?
Sure, it's a separate check.
It's coming from the state. They can't touch it. Well, special laws, your system's still tied to the city.
And see, what their discussion here is that there's basically there are two different pensions that these guys are involved with. One was a pension that was established in 1937. The other is a pension which began in 1977, which most of these guys are in that pension. 77, and that is paid by the state. This 37 Act, I think they written here in Anybody have questions? Regina, Carey? Well, as we find a need, Dan, we're going to do that, yes. There might be a time, especially when we get closer to the November 15th time, when we might need to come together again. And we'll arrange those things.
What I'll see if I can get a representative of that MDYs Anthem does.
Yes, I can email you their contact information.
Okay.
Come in and sit down with people, or find out where we can go, or talk to somebody.
What Dan is talking about here is when it's time to make contact and sit down and actually physically do the things necessary to sign up, can we put something together with MBYs and the answer is yes, we'll do our best. And she's already said that she can help us with some of it, okay?
And then I forgot to say, I'm not sure how much your pension checks are, but if it is, I would say between $1,200 and $1,500 a month, let's say that's your income you're working with, you also get what's known as, instead of tax credit, you get tax credits, but it also assists with your deductibles. So, cost sharing reduction is what that's called. And so like your deductible may go from, instead of $5,000, it would go to $1,500 or $500. It just depends on the size of your family and how much. But the less money you make and the more people that are in your household, they do compensate you in that way too. So I guess it would just depend on your income.
I think it would be, I'm sorry, Carrie.
No, that's fine. In the paperwork we gave you on the second or third page, that tells you the website to go to. Now, again, this is 2014 rates, and they're just going to be a rough estimate, okay? But it can get you the closest for your household, your family, okay? Go off of your taxes from last year, because that's what they're gonna base everything off of, just taxes. So that tells you step by step what you can do, how you can go. Again, it's just a rough estimate, but that will give you an idea of your family, your household, what you're maybe looking at. It will give you some plan options. It'll give you some rough estimates on prices, but that will be the best that we can give you as of right now for 2014, just because they haven't got the rates out yet.
Please do that, and if you have difficulties,
There's numbers, we've left contacts, if you guys have problems, please just reach out. There's several people out in the community that would be more than glad to help.
Should we try to put something together, Phil, after November 15th to, if people want to give their income and kind of walk them through it at that time? Or, to me, it seems like it would be better to do it then with new prices versus a rough estimate.
yeah, but what these, I think, they're still, yes, I'll say yes to you. But also what I want to say is, I think it's really important though for you to get an idea, to get an age on it.
Yes.
You know, Daniel had to talk to his mom. Won't you, Dan?
I'm about to talk to my tax.
Talk to your mom.
This is a tax.
Get on that computer.
No, I mean, if you work and try to do good, you're free.
Right.
If you project your income too high for next year and you don't make that much, then you're gonna owe your taxes the next year, and vice versa.
That's what I
opposite.
say,
If you didn't
you know.
include yourself enough income, then it goes the opposite way.
Right, because if you, let's say you just are retiring, so your income is going to be drastically different in 2015. What you want to do is to get the actual tax credit. I mean, if you put your current salary, let's say it's $42,000 right now, but then when you retire, it's going to drop you down to 20. You can do the 20 to see how much it would be, but if you pay more, then they do refund you. But if you don't pay enough, they take it from you as well. So.
Anyone else have questions?
What about the tax thing he's talking about, Bill?
The tax thing, I'll tell you what I can do. If you give me your e-address, I can mail you the actual paperwork that explains it to you, so that you can, when you file your taxes, all you have to do is just follow it. And it even tells you which line to file it on and the information that you have to put on it.
Doesn't that because you're paying your insurance through your pension and not separate, like,
Yes.
if you're paying your insurance separately, then you
Yes.
don't get it right?
Right. If you're still paying it through this system, like what's going on here, you can get them as a what they call PSO, or public safety officer, retired RA.
called Safer Program. It was like 2010 they passed it. If you do a search for that, yeah, it can come up. And if anybody needs help with that, me and Chris kind of went through that pretty in depth. That $6,000 that you guys can receive from the city, that stipend, that can all 6,000 of it can be offset by 3,000 of it through the Safer Program, and then the other 3,000 of it can go to healthcare savings account, which doesn't affect your adjusted gross income. So all 6,000 of it currently can be offset by those two things. Can everybody hear me? You can see that. Like I said, Chris and I went through it in depth. If you guys got a pencil and a piece of paper, write down my phone number, 765-461-6088. If anybody's got questions, I'll gladly, come meet you somewhere. You guys can come to my house or the fire station or whatever, and I'll try to, help you through it. I can get you information on that stuff, but as far as the stipend goes and affecting your adjusted gross income, it shouldn't if we can put 3,000 in healthcare savings and the other 3,000 in that Safer Program. So that shouldn't affect that.
Jake, come up and say that here. I'm not sure if you're getting recorded.
What's your phone number, Jake? Just 765-461-6088. What do you want me to say again?
The whole 6,000 thing again.
Okay. Can everybody hear me now? $6,000 that you would receive as a monthly pension stipend from the city can all be offset by two different programs. One being the Safer Program. Help. That's helps. That's what it is. I'm sorry. Helps. HELPS. Do a search on the internet for that, and it should come up. And you can put that's $3,000 for public safety officers only. No one else can use that, and that can go specifically to healthcare expenses, and that wouldn't affect your adjusted gross income. The other $3,000 could be put in a healthcare savings account, which that's available to anyone. I believe Renshaw may know a little bit about that. Did you talk?
Looked into the healthcare savings.
Didn't you look into healthcare savings plans?
That's what we're talking about. Trying to figure out how to get one of those for the group.
So there's.
Because we could all benefit from being the active one. If we can get that going as a group and have that set up, it benefits us all because you can take money you're going to spend, put it away tax-free, and then spend it on anything health. It doesn't matter what it is. You could go get liposuction at the end of the year. They consider that health. So if you say you want to put $2,000, $3,000 a year in it, at least the $3,000 a year you're hiding, which is basically what you're doing. You're putting it away somewhere so it can't be taxed. You can take that $3,000, put it into account, use the other $3,000 to pay whatever you're doing, or use that amount, and that way you're not having to mess with any of it. That's zero reported income.
Now, those are strictly for healthcare expenses.
Those people were out of Chicago. Do we have anything set up here for us now yet?
Now, that's something that we have to research and figure out.
Okay.
But both of those programs, the HELPS program
Everybody's available.
and the healthcare savings
Healthcare
plans,
savings is something we have to figure out as a group.
right.
That you can set it up.
And it doesn't have to be as a group either. You guys can do that individually. Through 396 or something, maybe we could come up with a program in order to do that. But I know that you guys can do that on your own too. So, but that's all. That would cover all the $6,000, so that wouldn't affect your income. Right. If you guys got any questions, you can ask now or call later.
I got a question. According to what I'm understanding, the city's gonna send me a check every month for $500.
Right.
Now, on your 65th birthday, when I qualify for Medicare,
That ends. That ends. As soon as you turn 65, that ends. Or qualify for Medicare. Same goes. So that $500 or whatever it is at that time, whether or not you're at the third year where you're getting $550, then.
now, another.
I'm sorry?
I've only got 9 months.
Okay.
Yeah, so now when I go to file taxes, and I've got that $500 for 9 months, I gotta claim that $4,500 as income?
Well, that's what we were just talking about. Through healthcare savings account or the HELPS program, you can offset that money that you would make by putting into this healthcare savings program or the HELPS program.
Do you guys know how the health works? Do you guys remember, did we tell you that?
It's strictly pension-based.
You have a 457 or a retirement savings plan of any kind, a 401k or an IRA or whatever you have that you put money into. You're able to take every year, say you get $6,000 a year, $3,000 that you can invest into that account and then pull that $3,000 back out tax-free during the course of the year to pay for your health insurance. And you get to do that with no taxable income. So it's basically the same thing as a health care savings plan. But during the course of the year, you're going to have that money invested into your retirement account, whatever you have set up. That money just goes in there. And then say you have $10,000 in there. Every year, you're going to put $3,000 in, pull $3,000 back out and pay for your premiums. And that's all tax-free. Doesn't count against your income or anything. So half of it is just right off the top gone. You don't have to worry about it.
Now, that's all, it's got to be pension-based. So what I mean by that is that money has to come out of your pension money that you get from the state. Okay, it can't come from the $500 check stipend that you're getting from the city. So what I'm saying is you can't take that $500 check that you have and put that into that HELPS program. That money has to come specifically from your pension, and you set that up through PERF. Okay, so that'll be, you can't confuse the two. Okay, so you just can't take that check that you get and go put it in that account. It has to come out of PERF.
When you walk away from here, you're gonna think about this tonight, tomorrow, Jake's ready for you.
Excuse me?
And I'm sure Chris too.
It's where your pension, well, no, your house.
Well, it could come through that as well. But it has to come from your pension. It can't come
from your pension check.
You can't go work a side job, take that money and stick it into that account. It has to come out of your pension. And that would be set up through the state or whoever your pension comes from. So, yeah, if you guys need anything, I mean, I can help as much as I can, and Chris will do the same. Yeah, if anybody has any questions, call me. I hope you wrote my number down. I'll answer it. All right? Thanks, guys.
Thank you, Jake. Thank you, Jake. Thank you, Chris. Take a shower.
Miss that.
Get with that. No, of course you do. I don't like any of this.
Okay. Anybody else have any questions then for Regina or for Terry? Okay. If you don't have any other contacts, 765-863-5559. I'll see that an expert takes care of it, okay? Thanks for having me. Thank you.